Welcome to the University of New England Center for Excellence in Collaborative Education's third in our series of 6 events brought to you with UNE's Planetary Health Alliance. Our mission at the center is to bring students and professionals with a wide array of expertise together to learn about, from, and with each other. I'm Chris Hall, the program manager for the center, and I'm grateful for your attention today as we present this interactive panel discussion about social determinants of health and the intersections with the Black Lives Matter movement and our LGBTQA community. We polled the folks who logged in a little bit before noon, and we have physician assistant, occupational therapy, physical therapy, public health, students, faculty, and staff from UNE and potentially Regis University in Colorado, University of Texas at El Paso, and the University of Louisiana, Monroe. So we're really thrilled to have everyone here together. Please be sure to let us know what your profession is and where you're Zooming from today when you post in the polls and in the chat. This is how we hope to learn about each other, not only interprofessionally, but culturally as well. At this time, I'd like to introduce our panel moderator, Jenny Audette, Doctor of Physical Therapy Program Director here at UNE.
Hi everyone, I'm Jenny Audette and I'm the moderator for today's presentation. I'd like to thank you all so much for being here, especially you students out there. We're looking forward to your participation in this interactive session. And I'd like to start by going over our 3 main objectives for the day. The first is to describe social and structural determinants of health, what that is and what the implications are for population health and wellness. We'd like you to consider your responsibility to learn about and respond to the needs of diverse populations and consider your role as an advocate for those we serve. We'll be trying to achieve these objectives through a variety of activities. We will have questions and responses for our panelists. We will have several poll questions that we hope you'll respond to. And of course, you can participate in the chats that we have going on Facebook and here within the Zoom meeting. So I'd like to start by having our panelists introduce themselves, and we are going to begin with Negeri Clarke.
Hello, my name is Negeri Clarke. I am a recent graduate of the College of Pharmacy at UNE. And I am happy to be here with you guys. And you all will be in my shoes very soon coming if you're graduating in 2021. So I'm happy to be here.
Thanks, Negeri. Next, we have Dr. Melissa Hoffman.
Hi, my name is Melissa Hoffman. I hail from Denver, Colorado, Regis University. I am a co-chair of PT Proud, which is an LGBTQ committee under the Health Policy Administration of the APTA. And I am very pleased to be here today with you.
Thanks so much, Melissa. And now Dr. Celia Paycheck.
Hola, I'm Dr. Celia Paycheck, an associate professor at the University of Texas at El Paso. For those of you who don't know where we are, we're located on the U.S.-Mexico border where the United States, Texas and New Mexico come together with Mexico, which is about 2,500 miles away from New England. I want to welcome all the students, but a particular shout out to my students. If they're streaming with us, they would have just finished exams this week. So if you're here, I'm really proud of you.
Thanks, Celia. And our final panelist is Dr. Lisa Van Hoos. Lisa?
Hello, everyone. Greetings from the Southern Delta region. I am Dr. Lisa Van Hoos. I am super excited to be here with y'all today. And for those of you who are wondering, we are about an hour and a half from LSU, but we are not LSU.
Thanks, Lisa. We look forward to hearing what all of you have to say real soon. And finally, I'd like to introduce our chat moderator, our Facebook chat moderator, Laura Ank. Laura?
Hi, my name is Laura Ank. I am a current second year DPT student here at UNE, and I'm very excited to be part of this event today.
Thanks, Laura. Okay, so I know that most of you are pretty familiar with the concept of social determinants of health, but as a little review prior to going to the panel, I'd like to provide a brief overview of the concept of structural determinants. These are determinants that are felt to be so important and powerful that recently people have begun to refer to them as predictive health and predictive of health and other outcomes. The concept of intersectionality asks us to consider the influence and impact of individual, group, and structural characteristics that in this graphic, you can see how we can think about those things. The inner circle represents an individual and their characteristics. The middle circle represents groups into which a person falls or associates. And the outermost circle represents the various larger overarching structural systems in which we live. From this frame, we can think about an individual in a certain context. Okay. Intersectionality conceptualizes how many of our beliefs and isms are related to and perpetuated by the structural systems in which we live. You can see some of those isms listed here. Take a moment to consider this idea and how these biases and isms have led to some of the recent current events and hot topics, such as the impact of COVID on certain groups more than others, access to telehealth, the Black Lives Matter movement, and recent threats to LGBTQ rights. These issues have been going on for a long time. They're nothing new, but these issues have been compounded by the pandemic and other recent events. Panelists, before we ask you your first question, is there anything that you'd like to add to the overview of intersectionality? Okay, great. Then I will start with the first question for the panelists. Oh, here's the definition of social determinants of health, just as a reminder to everybody. Again, those are those different factors that make us who we are and potentially predict our access to healthcare and health outcomes. Okay, panelists, the first question. COVID-19, the Black Lives Matter movement, and recent threats to LGBTQI rights have brought to light structural inequities that have existed long before these recent events. They've also amplified many health-related disparities across our country. What related topic are you most focused on right now? Lisa, would you like to start?
Sure, I can start. I would say probably the first two. So some of the activities that we're involved in here in Monroe is we've got an international research group that's really looking at the impacts of COVID-19 on health outcomes of cancer survivors and their caregivers, because that is another place that we've been able to see the impacts of structural and also social inequities. I also serve on the Governor Edwards Health Equity Task Force, and I'm on a subcommittee that's really focused on the needs of nursing home residents. But it's been enlightening to also be able to learn about the needs of prisoners, especially here in Louisiana, where we are known as the prison capital of the world. Not of the US, y'all, but of the world here in Louisiana. And then some other things that we are focused in on is in regards to the Black Lives Matter movement. Fitzgerald in 2017, y'all, published an article that said that for healthcare providers, our implicit bias is about the same as that of just the general population. And so we've really been focused on trying to get information out to healthcare providers and also doing anti-bias, anti-racism, culturally responsive pedagogy training for educators. So those would be the two topics we're most focused on.
Thanks, Lisa. How about Celia?
So El Paso is a medically underserved community with a high rate of poverty and a high number of people with limited English proficiency. And we know the literature really shows that people with limited English proficiency encounter high rates of health disparities, healthcare disparities, right, because of that lack of communication. So on a teaching and research level, I'm really interested in promoting my students' ability to work with Spanish-speaking patients who have limited English proficiency. So that may be working on their Spanish, or maybe them learning how to use interpreters, right? So to look at it broadly. But I'll tell you, on a personal level, I have really, really deep concerns about the health and safety of recently arrived immigrants and those who are asylum seekers, who may be in detention centers, just like Lisa talked about the prisons in Louisiana. We certainly have our fair share of detention centers around here, as well as other people living in poverty here. These are folks who cannot afford not to go to work, even if they're ill or they're going to be exposed. They cannot afford to social distance because of their housing situation. And quite honestly, some of them can't even afford a simple face mask. So it is a very complex problem.
Thanks, Celia. Negeri, can you add your comments?
Sure, just from a standpoint of a student who's recently been on clinical rotation, what I've noticed is that there is a barrier to access of care. It's consistent in pharmacy, usually looking at cost and availability of medication, and even ability to come and pick up medication if you're in a community pharmacy setting or if you're in a hospital or other clinical setting. So the access to care is still a major thing, and a major focus is how do you get people what they need now that they don't have the ability to come to you, A, and B, they don't have some of them are in rural areas. They're part of aging populations. So they also have less caretakers than they did before. So the people who may have helped them with their mail or other avenues of getting access to medication and healthcare are now that population is shrinking and closing in because of COVID-19. So from a pharmacy standpoint, that's consistently what we've already dealt with as pharmacists, but now it just seems to be growing. And a lot of the companies are working on different avenues of opening up things like delivery and shipping, things that aren't necessarily a part of their settings, to ensure that people have some access to their care.
Thanks, Negeri. Mel, what are you most focused on right now?
Hi, everyone. I think two of the biggest ways that the coronavirus is impacting, particularly the LGBTQ community, is one, like Negeri had stated, is access to care. So these barriers are going to leave this community less likely to get medical care, and then the existing disparities that exist already mean that more of us in this community are going to live in a state of compromised health. So we know current literature and research tells us that the LGBTQ community is particularly vulnerable to both the economic and health impacts of the virus, because they are more likely to work in industries highly impacted by the pandemic, such as service industries, and they may have more health risk factors that exacerbate the disease. So things like smoking is a really big risk factor for these folks. The other thing, just two other things that I want to bring up real quick, is a little bit about the legal inequities for the LGBTQ community. And these span across many areas, but what I want to talk about is employment discrimination. This disproportionately affects these communities because in about 30 states, it's still legal to fire someone simply for being LGBTQ. So this means that Job searching becomes unsafe for them, and to be authentic in their identities for fear that they won't get a job or be fired. And so in the midst of this pandemic, folks from these communities are more likely to work in jobs that are highly, like we talked about, affected industries. So often with more exposure and higher economic sensitivity to the COVID-19 crisis. And I know Jenny just briefly, we talked about this in the beginning, and I just wanted to bring up this idea of data. And this is a huge problem. And this spans across many different communities, not just the LGBTQ community, but many and probably all of our marginalized communities. And the problem is that there's not going to be any data. They're not collecting any data from these specific communities. And so there's going to be no data to really draw on moving forward for solutions to addressing the health disparities that I spoke of.
Thanks so much, Mel. I think it's just incredible how far-reaching the implications of what we're talking about are. I believe we have a poll coming up.
We do have a poll, and if you have logged in since noon, you might want to take a moment to open the app on your phone or scan the QR code or travel to a new tab. The link is in the chat, and what we want to know is what you are doing, what you're working on to help mitigate any of these issues in the short term. And this is sort of a short answer format. And you should be able to type right in to the poll everywhere when the question comes up. So what are you doing to help mitigate these issues in the short term? Open dialogue, good communication is definitely a key. Part of what we're doing here together right now is educating ourselves and others. And we heard a lot about barriers so far, being language, incarceration, access to care, legal inequities, and data, for those of us who don't think about the spreadsheets that run everything. Data is a big issue.
People trying to become more informed.
Yes, and that was one of the things that I just spoke about in the chat, is because, especially in the US, we are this beautiful system, right? Kind of we function as a federation, but that means each state gets to do it slightly different. And so then how do you combine those different working definitions? How do you integrate that data? And now we've shifted data from one agency to another. And so particularly for my interest area, which is nursing home residents, we've seen a drop in responses from facilities as they try to reposition, right? And understand how the data is going to be collected and the processing process and the reporting process. So I love that conversation of talking about the data, right? Because the data is going to drive the money and the policies. And we have some legitimate concerns about that right now.
And I think that the problems that the Census Bureau is having for overall data collection is going to bear fruit for a very long time.
Yes, and for those of you who maybe have not seen the announcement, the decision has been made to close the census reporting a month earlier than anticipated. And what are going to be the short-term and long-term implications of that?
Yeah, I think that point is so interesting. You know, in fact, I was thinking they would extend it, right? Before that happened, I thought, oh, we can, you know, just like our taxes, we got to turn them in later. I expected an extension, and for it to be earlier, it's really shocking. It's going to have major implications.
Yeah, and so for marginalized communities, particularly rural health, we are watching that closely, right? Because first of all, we've got some broadband issues. Mail service is not, for some areas, isn't quite as consistent as others, and that's just because of the nature of our states. So we're really concerned about how this is going to be managed and what's going to be the impacts to education, to our roads, and our other infrastructure.
I think just if I can add one more comment, I think like Lisa said, because this data is being collected so differently across the nation, that you're going to have disparity amongst your data. So you're not going to be able to really see who are the communities that are most impacted, and it's really going to impact how we're going to alleviate those disparities, right? So if we don't know who is impacted the most or how they're even impacted, because we're not collecting that data, then we're not going to have really solid ways to be able to help those communities to overcome the pandemic. So it really does extend out quite a bit to a number of different marginalized communities.
And I'm just going to jump in and just ask, I've seen a couple of people talk about various advocacy groups. If you would, in the chat, share that knowledge of which groups you are joining, because I've recently found out about a group that's working to eliminate the qualified immunity that police officers are given, because that's part of the reason why we're in the situation that we are. But share with us what groups you're joining and why you join them, so that we can also join those efforts.
Good. And coming from the chat, I want to share a few comments from our Facebook live feed here to add to ways that we're mitigating the issues in the short term. Ashley from Facebook contributes that she's keeping an open mind, listening and learning. And Sean, who's watching from Facebook, writes that Dr. Hoffman's concern about job discrimination is a reminder about how the USA's health insurance system is tied to employment. Do these concerns affect people's perspectives on universally public funded healthcare, is his question.
I have a question for Mel related to the rights of the LGBTQ community. Please, can you address the June U.S. Supreme Court decision that just outlawed employment discrimination based on LGBTQ status?
Oh, goodness. So there's so much legislation that has come out in the last couple of months as it relates to the LGBTQ community. We've had some wins and we've had some losses. The employment discrimination legislation was a win for the LGBTQ community. Unfortunately, there was Health and Human Services passed other legislation that allows folks to treat based on religious preference or beliefs. So that is something that we are still fighting the fight for. And Carla Bell out of Jefferson University and I wrote a little blog through APTA's magazine. The name is escaping me right now, but Jenny, maybe you can add to that. But we wrote specifically on that, just to let everybody know that PT Proud is definitely aware of current policy and legislation. We fall under Health Policy Administration section, so of the APTA. So we definitely are up on the policy. And employment discrimination, that ruling was a huge win for the LGBTQ community. So thank you for bringing that up.
I think, Mel, if you have the link to that handy, you could drop that in the chat for people to look at. But that feeds very nicely back around to Sean's observation about perspectives on universal publicly funded healthcare. Have you noticed any increased awareness or activism in that area?
So this is Lisa, everyone. So I was trying to really quickly look and see kind of what the updated poll results were stating. And what it looks like now is that people are recognizing the need for healthcare and healthcare access. But in regards to universal healthcare or one payer system, the majority of Americans still do not want that. They're really thinking that the private sector is going to come up with a solution based on some of the latest polling. What's your thoughts on that?
I just feel like there's such a disconnect between the way people receive care, like understanding all the backstage elements of how that happens, and the way that they consume information about it publicly. We do have another poll that we could move on to that asks, if I can get out of this one. Our next question is asking you, as a member of your profession, as a member of an interdisciplinary team, what qualities of your profession enable you to advocate for the health needs of society, as well as your patients? So thinking about all of those issues that we raised and all of those gambits that we considered just previously. And this is a ranking exercise. And so when it comes up on your screen, you'll have little arrows where you can move good communication skills to the top, and you can move other to the bottom if you want to. You can prioritize leadership or openness. And if you do think that other is important, please go ahead and put that in the chat, what we didn't think of.
Well, Chris, just thinking about what you recently just stated about the way people take in information about their health and things related to their health needs. A major part of the training that we undergo in most medical professionals, professional studies now, is using common language. So when a lot of these health plans and these legislations roll out, they're not in language that is user-friendly to the general population. We're taught to use language that would appeal to a fifth grader, not to sound condescending, but you have to consider the actual literacy level of the people that you're talking to when it comes to things that they're not educated on. I'm not a part of the research world, so what our fabulous panelists here are strong in, I'm weak in. So I would have to learn their language in order to be a part of that conversation. So for my needs, I would need them to explain it to me in a very basic way, in a manner that I could understand. And most people aren't getting that with legislation. So what they hear is over their head, and when they can't process it, the honest reaction is to stick with the evil that I know. Let me just stay here because I understand this. I know what this is. And if we shift and change it again, how would I go about shifting and changing, especially where it's a society built around a kind of a hierarchical system of the haves and the have-nots, and we, so much of what we are is defined by our titles and our status. Most people are afraid to step forward and say that I need help. I don't understand what's going on. So instead of saying that, let me stick with what I already understand, even if it's not working for me. And a part of, I feel, as a health professional, someone who wears a white coat, who is a part of a system now that could be seen as a separation for someone seeking care, a part of my job is to make all of that less scary when someone comes to me for assistance. If I don't know the answer, I need to reach out to someone who does. Social work, PT, OT, someone knows the answer if I don't. We're all trained professionals. So I know to reach out to my other team members to make sure that whoever's seeking care is getting the best care for them. And I think that's important as part of an interprofessional team, is to make sure that you're keeping the lines open between you and your other professions. And if you don't know the professions, get to know the professions, what they do, and you have to advocate for that system of integration, I think.
Thanks, Negeri. And that lines up really well with the way that the poll is shaping up. Good communication skills and openness to others' views are dueling it out for first and second place here. And being open to others' views, it doesn't mean that they're going to give them to you. You need to seek them out sometimes. You need to be actively curious about, who are you? What does your profession do? And how can we work together?
I'm really happy to see, I was watching leadership move kind of up in the ranks, because it's so easy to become a leader in any one of the topics that we've talked about and be able to impact through leadership in all different ways. So I was sort of watching it down at the bottom and thinking, no, it's got to go higher. It's got to go higher. And I'm glad it has, because I think that's an important one too.
Yeah, this is Celia. I just want to echo what Jenny said. I think students and new graduates really underestimate their ability to be leaders, and how much each profession wants them to be leaders. Like, do not underestimate your power, right? And your responsibility to be leaders. We want you there as the older generation. I can tell you, we want you there. We need you there, and it is your duty to be there.
I could not agree more. And especially as we are still grieving the loss of John Lewis. I mean, he was younger than most of us on this call when he began his journey. So if you need an example of how young people are needed, your expertise is needed, your different perspective is needed, that there is no greater example. So yeah.
Yeah, Lisa, actually, I was just thinking about him earlier. The same idea, right? If all the people on our call were some version of John Lewis, maybe not with that breadth of impact, but took the long view like he did, right? Like, his struggles continued till the last moment that he took a breath. But look how far he came and what he changed with his efforts. It's absolutely remarkable if we could all take that long view.
Thanks, everyone. I think that with this in mind, we'll go forward to our next panelist question.
Excellent. So this question has two parts, and we're kind of thinking in terms of moving forward. It's been said that we're at a critical moment of ethical reckoning, where COVID-19 has simply heightened our awareness of inequities. But COVID will end, but the inequities will persist. So for the panelists, what do you hope changes most moving forward? And what lessons can we learn to avoid repeating our past mistakes? And I think we'll start with Negeri this time, if that's okay.
Sure. So a big part of who I am as a person in general is I try to be more introspective when it comes to dealing with new people in general. As a professional, I found it in a lot of these settings, you have to start with you, set your intention. So moving forward, as far as the changes that are coming, I would implore everyone, especially new grads and some seasoned veterans, to check what's in your pocket. Check what's in your own pocket. What are you carrying with you when you walk into a meeting, when you go into meet or speak to someone? Are you trapped kind of behind the wall of your own perception? And we all get there sometimes, but it's very important to be aware of your own biases. Not saying that you need to throw them away and that all biases are bad, because that word bias nowadays has a very negative connotation when it comes up. All of them aren't negative. Some of them help us to form our own boundaries that help keeps everyone safe in a situation. But you need to check yourself at the door and what your intention is going into a meeting, going into dealing with a patient or someone seeking care. When you reach out to someone else and when someone else comes to you for assistance or aid. I think this all starts with making sure that what you are doing, that you are fully aware of what you are doing. And when you build that self-awareness, you can have a broader impact and be of more service to other people. We're all service agents in our field. That is what we signed up for. So a part of that is separating yourself from how you may feel, think, or believe, and just seeing the humanness of someone else so that you can give them care, the care that they came to seek. I can't say that I'm without my own biases, but at the end of the day, the job that I signed up for was to care for someone else. So that comes first before how I feel. You just have to be aware of what's going on, what you have in your own pocket.
Thank you so much. I love that response. Celia, how about you? What do you hope changes?
Well, on a personal level, on an individual level, I hope people examine their own privilege, right? To have really think about their own privilege and then leverage it for others. And that's for everyone, right? A person of color may have their challenges, but perhaps they don't have a disability. So they have a privilege that they don't even recognize, that they can then advocate for someone with a disability, right? So I think we need to look across all flavors of diversity and think about how we have different layers of privilege. Beyond that, more broadly, I would love that every single health profession program integrates and truly solidifies a public health focus, recognizing that we cannot fix problems by treating one patient in front of us in an exam room at a time, that it's going to take looking at things through the lens of population health, and that each student graduating is empowered and obligated to come out of school understanding that how they're going to improve their patients' lives is not only by providing the great care that Negeri just talked about, but to think about social and health policy and to try to advocate for that change in a meaningful way.
Thanks so much. I'm going to remember that at our strategic planning meeting next week. So how about Mel? What are your thoughts?
So I think as it relates to the LGBTQ community, I think visibility matters. So advocacy efforts for these communities have to be part of advocacy efforts of other unrepresented groups. So intersectionality has to be the approach that we all take for health. And for every community that's siloed without intersectionality highlighted loses out on the global power of advocacy. So for these communities, more than ever, now visibility is paramount. The responses to COVID-19 by government on down to us as individual healthcare providers or practitioners must consider the unique situations of these communities in their plans for addressing the crisis. So as a profession, the many solutions and plans being put together, the webinars that speak to action, should all make sure that these communities are represented and spoken about. And if they're not, then our profession is not stepping up to be part of the solution to the health disparities that we all have been talking about today, that continue to exist for these communities. So the first step that we can take is educating ourselves around the healthcare and the health disparities that exist for these communities. So disparities that are new to COVID-19, but also not forgetting about the disparities that they have been experiencing for decades. So this is not something that is necessarily included in most PT program curricula. So with that in mind, how can we expect our practicing colleagues to know much about these communities' needs? So it's really important that we continue to educate, right? And to disseminate this information nationwide.
Thanks, Mel. I'm going to ask Lisa to respond, and then I'm going to get a little input from Laura in the Facebook chat. So go ahead, Lisa.
Awesome. So I would say what I'm hoping, what do you hope changes as we move forward? I think it is now we're at a place where each of us are really kind of thinking about our own lives and our mortality. I think that is the gift that came from COVID-19, that it has given you the opportunity to realize how precious life is. But we were all called into existence for a purpose. And I think asking yourself that, if the universe, God, whomever it is that you worship or think about, if you were called for a purpose, what is the problem you were meant to solve? In whatever your sphere of influence may be, it may just be within your household, within your community, on a national, international level, but what was the problem you were called to solve? And then, because these are big, complex, multifactorial issues, who do you need to partner with? Because often, not just in healthcare, but in business, education, whatever professions we're in, we often come at the issue from, this is what we're going to tell you. And really, we've got to pivot from that and say, what is it that you can tell me? And I love how Negeri said, we are service agents. I think that's what you said, right? So to be of service to someone, first you've got to ask them what their needs are. And then you got to partner with them to design the intervention, the project, that whatever it is that's going to be done. So I think this is an opportunity for us to switch our mindsets in regards to that. We are the only doctors and professions. There are professional community members that can tell you more about that community than anything that we could read. And Ashley talked about from Facebook about doing no harm. I think the greatest harm we do is when we go into communities as if we are the experts of those communities. So my last thing, because I don't want to talk too long, is also I'm hoping that we stop with the temporary saviorism, where right now it's a big issue and we're going to fix and save the world. Really what we need to do is partner. And because when we come at it from a savior mentality, it's not about the other people. It's not about the community. That's all about you. That's all about you feeling good that you came in, put your cape on and saved the day. And really making sure that we look at the root causes so that we can dismantle the structures and societal influences so that 5, 10 years from now, 30 years from now, we're not having the same conversations, y'all.
Thanks, Lisa. Laura.
I completely agree. We have a lot of fantastic participation coming from the Facebook side of things. Heading back to the previous poll we just took, Sean, who's watching from Facebook, adds that something just from healthcare workers in general we have is loads of privilege in the grand scheme of society. So I think that ties really well into what Negeri said about recognizing what we bring to the table as healthcare providers and figuring out the best way to use that privilege and checking what we have in our own pockets. Lisa, I believe you mentioned this as well, that Ashley, who's watching from Facebook, shared that, quote, I think we have seen a lot of harm being done to each other. Despite our thoughts and biases, we should cause no harm to our clients and help the best we can. I want to see more helping and loving than harm. And I very much agree that I think that is the ultimate goal at the end of the day, being in the healthcare profession.
Excellent. Thank you, Laura. I think we're ready to queue up for another poll. And asking again from your professional standpoint and thinking about the greater professional team around you, which might be health professions, but maybe other kinds of professions. How can you help promote justice in patient care and mitigate the effects of these isms and biases we've been talking about? And this is a short phrase kind of answer, and you don't need to connect your answer with the underscore. You can just type it in.
As we give time for people to answer the poll, I want to share a few more comments we have coming from Facebook here. Again, great participation. Isabel from Facebook adds, to go off of what Lisa was saying, that she definitely agrees the savior mentality has been one of the most frustrating things that she's noticed from her fellow students.
I just wanted to say, as a pharmacy student and at my clinical sites and now moving into practice, we use a lot of the research that you all do to drive our clinical decisions. So there's not a separation. I wanted to make sure that there's an awareness brought to the conversation, that there is not a separation from, aspect wise in clinical practice. The research that everyone does, that a clinical researcher does, is paramount to how we proceed in treatment. So your data drives how we approach care and what kind of care we give and how we may step into a room. We don't always know the environment we're in. As Lisa said before, the people of that community, the educators, other people who have different demographic data serves our purpose because they lead us to understand the community that we're serving with the level of sensitivity. So I did want to bring an awareness to that conversation that there's no separation on this clinical team of panelists. From my standpoint, I don't see it as a separation. We utilize each other in different ways. So the research that you all do, it really does drive how we bring care to a community. I just wanted to say that. I felt it was important.
I completely agree. And I think another comment that goes really well with that is David, who is one of our Facebook viewers. He writes that although physical therapy may not be immediately seen as a profession that's in the trenches fighting to close the access gap, PTs do provide care and they allow patients to optimize movement and maximize ability. So in this way, PTs are invested and they should invest more. David also points out that practicing PTs and student physical therapists should mind the vulnerable populations, such as recent immigrants, the rural communities, the LGBT community. This should be discussed today, and we need to realize that we should be advocating for these groups on the political stage. He points out that this is something that the reality that the students need to face now, because the only way to make advocates and to create these agents of change is by orienting yourself to these political problems as a student and moving forward, keeping that in mind as you go through your career. He also poses the question of, does an intersectional/interprofessional newsletter exist that might help accomplish this goal?
That's an excellent question, and I don't have an answer for that right now, but I will look into getting an answer for that. I think that leads nicely into our next panelist question. And so we're going to leave the poll, but thanks. There's such great content here in the poll. Thank you all for being so thoughtful and for sharing your thoughts with us.
Yeah, it's a perfect segue into our final question for the panelists, which is related to advocacy. There are a list of some unfortunate examples of narratives listed below the question, but many disparity narratives, such as those listed there, perpetuate harmful stereotypes and misunderstandings and run the risk of widening health gaps. What steps can we take as individuals now and in the post-COVID time to advocate on behalf of our clients, neighbors, peers, and communities that will help us to ensure that the ripple effects of the current issues don't make even wider gaps and disparities? And we are going to start with Negeri.
So I don't see her name up anymore. I think I lost her in the blend, but we said, I know it was mentioned before on the previous topic, the concept of being a leader, especially as a new grad and when you're coming out of school, what you're going to find is that in some settings it has an extremely old academic way of practicing, and how we're taught at UNE is an interprofessional integrated model, which is really what will move the future. You have to be an advocate for your practice. If you are somewhere where interprofessionalism is a major part of what you do, you participate. If you're where it's, trickling, you advocate, and if it's non-existent, you initiate and ask those questions. You can't be afraid to ask the question. If you don't ask the question, then the process will never begin. A lot of people in the room aren't thinking like you are. They're not feeling like you are. And I know when you're new and you're in a new setting, you kind of want to hide, especially if you feel marginalized. But it's going to take a bit of courage, but use what you learn in school as a place to practice and learn from your classmates, from your professors, from the environment that you're in, and notice what you like and you dislike, and ask yourself, how can you be the person to make a positive impact on the things that you don't necessarily agree with and on the things that you feel that are positive. So it all comes down to having the courage, I guess, to be consistent. And as far as students are concerned, I know the political aspect was brought up. If you can vote, vote. Don't believe that because we're young or there's youth in your veins, you have time. Your time is literally now. It is actually right now. If you want to be that thing that changes, or if you want the world or your environment to be a particular way, you have to be an active participant in making it that way, as Lisa said before. So you can't wait. You can't wait for time. We don't have that time. The time is literally right now. So pick a area that you're really invested in and advocate for that area. Pick something that means something to you. Just make sure that you're purpose driven.
Great points, and I love your use of the word courage. A lot of people in the last poll mentioned standing up for what's right, and that does take courage. So great point. Mel, I'd like to ask you to respond next.
So I think we need to revisit the humanity side of what we do as healthcare professionals. So I think oftentimes we get wrapped up into the clinical expertise of what we do and the social determinants of health, which literature has indicated are indeed more relevant to health outcomes overall than a focused immediate contributor. They get left behind or mitigated to a few hours of curricula, or not thought of in a comprehensive way in our screening of our patients or in our treatment plans and home exercise programs. So we're on the way to a complete overhaul of healthcare delivery in this country. And I believe that we can be on top of that wave if we start practicing in a more holistic way of physical therapy that does not incorporate necessarily the social determinants, just solely the social determinants of health. Health policymakers and legal legislation has to address equity in discrimination policies to be inclusive of these communities. And you know, I want to put it out there to not just the physical therapy community, but all communities that are on the call today. We are actually finalizing a research study that we just, it's one part of a huge research study, but we're looking specifically at cultural competence and cultural humility of providers as it relates to, specifically for this study was the LGBTQ community. And we're getting ready to publish here in about a month. And, you know, we got together yesterday and we looked at what all of these themes after coding. We did about 35 focus groups, talked to over 100 individuals across the United States. This was a nationwide study. And all of the things that we were talking about today are really coming out of that research. So things like advocacy, things like attitudes, things like implicit and explicit biases, right? These are all coming forth in the data that we're getting after talking to all of these individuals. And there's such a need for us to really invest in our community. And physical therapy, it's moving in that direction, right? as it relates to the LGBTQ community, we're slow on the uptake. Hopefully this study will really get some awareness. That was another theme that came out, is awareness, right? And so this is where, you know, your implicit biases, your ignorance, bigotry, all of those sort of things kind of stem from the overall theme of awareness. And so what we found in our research is that is a huge problem, right? People don't innately want to be bad people, right? People oftentimes think that they're good people and they think that they're doing everything that they should be doing. But it's this awareness of implicit biases or ignorance that people don't even know that they're doing, okay? And so it's really important that we keep having these discussions and these conversations, and that you do continue to educate yourself, right? If your institution is not going to do it, get out there, man. Get out there and find it. Talk to other people. Hopefully the study that we published will shed some light for individuals. We're hoping it goes out through PT Journal. So hopefully it'll be disseminated across the nation so that there's a number of folks that will have access to it. And of course, we'll post the links as soon as we get them so that everybody will have access to this research and to this data. Because I just want to say one more thing. This data is important for our LGBTQ community, but this data, it intersects with all of the other intersections, right? All of the other marginalized communities are experiencing the same disparity, right? Experiencing the same conditions in the workplace, experiencing the same conditions in academia. So it's relatable. It's relatable to all disciplines.
Yeah, thanks so much for your work in that area too, Mel. Celia and Lisa, we just have about 1 minute left. Any final comments you want to make?
I would just say to be intentional about promoting diversity and inclusion anytime, anywhere. We've just created within our own program a diversity, equity, and inclusion committee so that we can intentionally be allies for all marginalized groups. And I'm really proud of that. I think it's going to create real change.
Awesome. Thank you. Lisa?
And I would just say use social media. The research shows that people are using that as the primary source of information. So we've got to make sure that we put good information in there. So I would say get into some good trouble using social media. Because right now, less than 60% of white Americans will post race or race relations in their social media platforms, right? So get out there, use social media, see the bias. So actively look for bias in your policies and procedures, regardless of what discipline, industry you are in, because data is not neutral. I think someone in the Facebook post said that. And with that, look at where you're using race-based medicine or care. So for us, things that we look at is like pulmonary functioning testing. The BMI, y'all, we published race adjustments for BMI a long time ago. Those were never really integrated. And now we're at the place like, do we even need them? Should we just get rid of them? Also in regards to biochemistry, for those of you that are dependent upon lab results, there's some race-based medicine that we use there too. And we're probably at a place that we should discontinue that. And then to answer someone on Facebook that was asking about the newsletter, that is talking about knowing your community. So although I couldn't think of a newsletter, there are county health rankings. There is what is known as the Social Vulnerability Index, which will tell you about the structural and social inequities in any zip code, almost down to the census tract if you would like it. Things like walk scores, nutritional indexes. The data is out there. I'm on fire, y'all. The data is out there. You just have to go look for it. And then the last thing is Toni Morrison, The Origin of Othering, is a great book that kind of gets to what Melissa was talking about. The process of marginalization is the same across any of these groups. And then a great book for thinking is Upstream by Heath that kind of talks about how can we get in a prevention mindset instead of a responding mindset.
Thank you so much, Lisa, for your final comments. I'd just like to thank The panelists, especially, so much for being here and all the prep work you did related to this presentation. Thanks for all you attendees out there. We hope this has prompted some deep thinking, and thanks a lot.
Thank you. Thanks, Jenny. Please take a moment, especially if you're from UNE, to complete the attendance survey. You can connect to it via the QR code on the screen or type in the bit.ly link, which is also in the comments. And we invite you to join us again on Thursday, September 17th from 12 to 1 for Pandemic Reflections, focusing on climate change, science, and action, which will be hosted by the Planetary Health Alliance. Future events will address public health and economic impact. We look forward to seeing you there. We hope that you will be well and go courageously forward from here. Thanks so much to everyone and have a fantastic day. Bye-bye.